What I'd like to do at this time is invite our participants in the quiz up to the front. We have Linda Bayers, Missy Searle, Evelyn Abudoulay. They are the blue team. On the green team, we have Barbara Clow, Kathy Leslie, and Leah Nicholas. I was on the quiz, and I'll ask you a question about that when we're finished. So we are about to begin. Blue and green are our teams. Okay, let the game begin. Question 1, what is health equity? A, everyone has a fair opportunity to be healthy. B, it's acceptable for some people to be healthier than others. Or C, everyone has the same health status.
A.
Everyone has a fair opportunity to be healthy. That is the answer, the correct answer to that question. So that's 10 points for the green team. There are preventable gaps in health between different populations, as we've been talking about this morning. So health equity is about the differences in population health stemming from inequitable economic and social conditions that are avoidable and unjust. Question 2, societies with the best overall health outcomes are those with A, universal healthcare systems, B, smaller doctor-to-patient ratios, C, greater overall wealth and income, or D, more equally distributed wealth and income. Okay.
D.
D, more equally distributed wealth and income.
Oh. Woohoo! Come on, people!
That is the answer. Thank you, Lee. The gradient in health, as I said this morning, is closely tied to the gradient in income. The gap between the rich and the poor in Canada is increasing. And in Nova Scotia, the income gap between rural and urban communities is the greatest in the country. Rural communities have lower incomes and higher rates of chronic disease and injury. Question 3. The most wealthy households, the top 10% in Nova Scotia, own 50% of the province's total wealth. The least wealthy households, the bottom 40%, own what percentage of the province's total wealth? A, 20%, B, 11.5%, C, 3.6%, D, 7.3%. That's good. And the answer is? C, 3.6%. That is correct. So that was the green team. That is the correct answer, 3.6%. Health and illness, and wellness, pardon me. A, vulnerability to disease. B, eating disorders. C, self-esteem. D, coping abilities. Or E, all of the above. Okay, who's that?
E.
E, all of the above. Chronic stress is linked to higher rates of illness, anxiety, depression, chronic disease, and in extreme cases, crime and suicide.
I object. Our team's older.
The following factors was identified to affect all aspects of health for African Nova Scotian women and their families. A, unemployment. B, racism. C, shortage of physicians. D, transportation. Or E, all of the above.
E. Come on. E.
Sorry. No, not E. That is the incorrect answer. Racism. Sorry about that. They had it right, though. Racism is the correct answer. Racism has profound effects on health. It intersects with other health determinants, such as socioeconomic status and gender, to increase the risk of mental and physical health problems, even among people who are well off and well educated. Who rely on food banks and meal programs each month is A, 2,000, B, 40,000, C, 750, or D, 8,000. All right, looks like the blue team has a response. Your response? 8,000 is incorrect. Over to the green team for a response. B, 40,000. That is the correct answer. 10 points for the green team. Individuals and families relying on food banks and meal programs often still have problems meeting their nutritional needs and encounter stigma associated with relying on charity. Question number 7. Mental health status of Atlantic Canadians varies significantly from province to province. Which province has the highest rates of depression in Atlantic Canada? Is it New Brunswick, B, Nova Scotia, C, Newfoundland and Labrador, or D, Prince Edward Island? Blue team. Newfoundland and Labrador? That is not the correct answer. Green team, would you like to take a yes for 5 points? They said C, Newfoundland. Your answer? B, Nova Scotia? That is the correct answer. The prevalence of depression in Nova Scotia is nearly double that of Prince Edward Island and Newfoundland and Labrador. Nova Scotians who report a strong connection to their community also report much lower rates of depression than those who are not strongly connected to their communities. Question 8. Food security means having enough safe and nutritious food to be healthy and active. In Nova Scotia, a family of 4 relying on income assistance would have a monthly deficit of how much if they were to purchase a basic nutritious diet? Would it be A, $652 a month in deficit, B, $134 a month, C, $251 a month, or D, $421 a month? Okay, we have the blue team. What is your answer?
We're guessing A.
A. That is not the correct answer. Over to the green team. Your answer is D. That is the correct answer. So a family of 4 relying on income assistance would be more than $400 in deficit if they were to purchase a basic nutritious diet for their families. 9.3% of households in Nova Scotia report moderate or severe food insecurity. Many individuals and families relying on income assistance and minimum wages are food insecure or are at risk of being food insecure. Question 9. Living with a disability means that a person's everyday activities are limited because of a mental or physical condition. The national disability rate is 14.3%. What is the disability rate for Nova Scotia? Is it A, 15.1%, B, 10.5%, C, 20%, or D, 14%? We have the blue team very quick on the draw. What is your response, please? It's A, 15.1%. I'm sorry, that is not the correct answer. To the green team for 5 points. Neither is that the correct answer. The correct answer is, oh, you said C? That is the correct answer. Woohoo! 20%. Nova Scotia has the highest disability rate in Canada. Disabilities can affect people of all ages, races, ethnicity, gender, socioeconomic groups. And living with a disability presents challenges for economic and social inclusion and increases the likelihood of discrimination. Number 10. In Nova Scotia, how many times more likely are children of single mothers to live in poverty than children of 2-parent families? Is it A, 10 times as likely, B, 2 times as likely, C, 8 times as likely, or D, equally as likely? Is that the green team? You're going with A. That is the incorrect answer. Over to the blue team for 5 points. D is also an incorrect answer. The answer is 8 times as likely. 8 times as likely. B, education and income? Yeah. That is the correct answer. So it's 10 points. 10 points for the green team. Higher education and greater income increases access to resources for good health. Education and income intersect with gender and other determinants of health, such as racism and other isms, work environments, to influence people's health. Number 12. Nearly 1/3 of seniors in Nova Scotia live alone. Seniors who live alone, particularly women, are at greater risk of poverty. The rate of low income for senior women who live alone is what compared to seniors living with families? Is it 3 times higher, B, 10 times higher, 5 times higher, or D, 12 times higher? That is the blue team.
You go ahead.
What's the
B.
B? That is the correct answer, 10 times higher. Living in poverty increases the impact of other factors affecting the health of seniors, such as availability of services, transportation, and social isolations, problems for some seniors, particularly in remote and rural communities. Number 13, the following factors were identified as health priorities among First Nations and Aboriginal people in Nova Scotia. Which factor was considered the top priority? Is it A, addictions and substance abuse? Is it B, mental health? C, diabetes and obesity? Or D, elder care? Hey, it's the blue team. No, sorry. I think it's A. Okay. Do we have, that's actually the incorrect answer. Do we have?
C.
You think it's C? Nope. Which is also an incorrect answer. B is mental health. Mental health is the number one priority. Did you say B?
No.
We'll let you guys work that out. There are large gaps between the health status of Aboriginal and non-Aboriginal populations in Nova Scotia. These inequities stem from the far-reaching effects of cultural oppression, colonization, and systemic discrimination. What is the employment and income gap between racialized Canadians and Canadians of European descent today compared to the 1970s? Is it A, is the gap greater? B, has it remained the same? Or C, is the gap smaller? Okay, blue team, you say A, the gap is greater. That is correct. Racialized Canadians experience a range of systemic barriers to employment and income, and we heard about many of those this morning. Unrecognized credentials, costs associated with accreditation, and discrimination in hiring and promotion. Just some of the barriers. What percentage of the LGBTIQ community in Halifax reported experiencing negative attitudes, homophobia, due to their sexual orientation or gender identity from primary healthcare providers in Capital Health? Was it A, 25%, B, 40%, C, 52%, or D, 66%? It's the green team. Let's have an answer, green team. What do you say? D it is. 66% reported negative attitudes from healthcare providers. Systemic discrimination, lack of appropriate services, and encountering insensitive healthcare providers are barriers to quality healthcare for LGBTIQ folks. In Nova Scotia, 49.2% of working-aged immigrant women have a university education, compared to just 16.2% of non-immigrant women. The unemployment rate of non-immigrant women in Nova Scotia is 7.3%. What is the unemployment rate of immigrant women in Nova Scotia? Is it A, 3.2%, B, 13.5%, C, 7.8%, or D, 9%? That is the blue team. Oh, that's the green team. Okay, what is your answer, B? That's a very good answer. 13.5% is the correct answer. And combined with socioeconomic status and culture, has important effects on injury rates, particularly for men and boys. In Nova Scotia, until what age are males more likely to experience injury than females? Is it 14, B, 24, C, 45, or D, 65? The green team. That is an incorrect answer. Okay, discuss with your team. Now over to the blue team for a 5-point rebound. That is also incorrect. It is actually D. In Nova Scotia, Canada, and internationally, males are more likely to suffer an injury until the age of 65. Higher injury rates among men are linked to socialization of males as risk takers, riskier working conditions, and higher rates of violence. According to research about North Preston, which of the following factors was associated with higher rates of chronic illness in this African Nova Scotian community? Is it A, geographic distance to hospital or health services, B, socioeconomic status, C, environmental hazards, or D, none of the above? In U.S. studies, systemic racism and discrimination have been identified as underlying factors for chronic disease among African Americans. Although these factors were not explored in the North Preston study, the authors do suggest racism should be explored as an underlying factor in chronic illness. The rate of attempted suicide among Nova Scotian women is 0.06%, or 6 in 10,000. What is the rate of attempted suicide among First Nations and Aboriginal women in Nova Scotia? Is it A, 20%, B, 1%, C, 5%, or D, 10%? Not all communities are affected to the same extent, but suicide is a critical health concern for First Nations and Aboriginal people in Nova Scotia. Aboriginal communities in Nova Scotia have identified the need for community-wide healing initiatives. Which of the following policies impact health equity? Is it A, affordable housing, B, employment equity, C, cultural competence in healthcare, D, community planning and zoning laws, or E, all of the above? Policies at all levels, government, community, and institutions, impact the health of populations. Public policies can create social and economic conditions that ensure everyone has the opportunity to be healthy. Thank you very much. So let's have a final score. Could we have a final score, please? Green team, 80. Blue team, 65. A very, very tight game. So for our winners, we have copies of The Spirit Level, an absolutely fabulous read, which I'm sure you will all enjoy, and I hope you will share with your friends and colleagues as well. And for the runners-up, there are no losers in this game. For the runners-up, we have a book called About Canada Health and Illness by Dennis Raphael from a local publisher. We do thank you for your participation. Any opportunity to use the quiz or the materials, we're happy to respond, so give us a call, and please enjoy the rest of the day.